Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon, the founder of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a very interesting and important topic, and that is, when do non-surgical treatments play a role in anti-aging and facial rejuvenation, and what are the top 5 most common treatments that we perform in our practice? All right, so here goes. So number 1 on that list is Botox. Now, here's the deal with Botox. There is no surgical counter to this. There is no way to do something permanent than what Botox is able to achieve in a more temporary basis. And as a result, it plays a central and very important role in the particular thing that it treats. And that is the prevention and treatment of lines around the eyes. Now, this is the underlying reason that the Botox even becomes a thing and why it becomes a necessary part of anti-aging, and why even as a surgeon I put this in a very special category and we use it commonly and recommend it always. And this is what it comes down to. As we age, the skin gets thinner. We all know that. It loses elasticity, loses collagen, does all these things, right? So as a result of that thinning of the skin and loss of elasticity, the muscles around the eyes, which are very animated, right? We raise our forehead, we form the 11s, little crow's feet around the eyes. All that constant movement is causing the skin to flex. And basically over time, those lines go from being there only when we're animating to being there always. Now, what Botox does is it goes to the source of the matter. It decreases the contraction strength of the muscle. It doesn't necessarily have to eliminate it. Like for example, I have some Botox going on, in my 11s, I have a little bit in the corners of the eyes. I'm still moving all these parts, but they're moving less dramatically and as strong as they normally would, so they don't have as much power or opportunity to form a deep crease. And when you can avoid forming a deep crease, you're basically preventing that line from being there even when you are not creasing, and when you're not frowning, and you're not moving your eyes and brows and all those type of things. So the idea behind Botox is to decrease the amplitude of muscle contraction so that lines can basically prevent from forming if you're lucky enough to start doing it earlier on, or if you're older and you've already have some lines, then this is the best way you can minimize them and decrease their presence. So Botox, lines and wrinkles around the upper third of the face, excellent treatment. We use it all the time. It's been around for 20, 30 plus years. I lose track of time, but it's been around forever and shown to be extremely, extremely safe and very, very effective. So number 2, BBL. Now, BBL stands for broadband light. Its cousin or its analogous laser that's more commonly known as IPL. BBL is a brand name for the lasers that are coming from the Cyton company. Cyton is a very well-known laser company, as there are many other ones out there, and the BBL is a particular treatment that is used for browns and red spots. Remember, browns and red spots accumulate as a result of sun damage, as a result of years and years of sun exposure. So even if you're excellent with sun protection today, the sun that you got 10, 15, 20, 30 years ago is now showing its effects. And it usually shows its effects by the production of melanin or overproduction of melanin that then surface to the top of the skin, causing clusters of brown spots known as brown pigmentation, or they cause weakening and breakdown of the capillaries around the face. Basically, they manifest in red spots or broken capillaries. So BBL is an incredibly useful tool in addressing brown spots and red spots. Now, the way it works is the particular wavelength that we're choosing to use is either going to attack the brown pigmentation, or it's going to attack the red, which is going to have a different source or different energy associated with it. But a properly trained technician can manage the differences here and treat both of this in the same setting. And what ends up happening is you need to treat it between 3 to 5 times to get the best results. So remember, if you're getting an IPL or a BBL, you want to treat it 3 to 5 times. Don't just treat it one time and then get upset that you didn't get the full level of correction that you see elsewhere. You really want to make sure that all these treatments are being done the right way. The third most common treatment, believe it or not, even though I generally speak downly on fillers, fillers have a place in the facial rejuvenation continuum. But the only thing is they can't be used or misused for certain things. So for example, you can't use fillers to lift the face. We don't do that in our practice. You can't pile a bunch into your cheeks and temples and try to, elevate the jowls and the jawline and the neck and all that kind of stuff. If you try to use it for that, you end up looking like a blowfish. You're gonna look weird and you're not gonna like it. And we all know what that looks like. But specific things. For example, little small amounts under the eyes, little small amounts in the lips to give a little bit of augmentation, freshen them up. Laugh lines, smile lines, just a little bit. Temple, when you lose a little bit of volume, putting a little bit back in there. Around the mouth here, the pre-jowl region, you can add a little bit. This is all for people who just have a small amount of volume loss but haven't had a significant amount of volume loss, and as a result, we'll see an improvement in that area. So number 4 is microneedling. Microneedling is basically the function of using small needles that poke tiny little holes in the skin. I know it sounds barbaric, it sounds kind of painful, but trust me, we numb the skin and so you don't feel a thing. But what microneedling does, and why I like it so much, is every one of those little needle pricks is causing an injury to the skin. And even though it's a minor injury, which you wouldn't even realize is happening, but what it's doing is it's sending a signal down to the cells within the skin to stimulate collagen and start to heal. So the fibroblasts, which are the cells inside the dermis of the skin, get that signal and then create collagen, because one of the things that happens as a result of aging is our collagen production is constantly diminishing. And by using methods that are bypassing the natural reduction in collagen production, we can then boost our collagen production and keep our skin from getting thinner with age, and inducing collagen to get our dermis back to being thicker with age. And that's a very important thing. Again, just like everything else, the effects are not forever. You've got to do this at least 3 to 4 times a year if you want to keep the collagen machinery going. Very, very useful, very important thing for those. Now you can use it on your eyelids, you can use it on your face, you can use it on the neck, but again, it's not tightening anything, it's just stimulating collagen, improving the quality of the skin. And number 5, most commonly used treatment in our practice is the halo laser. Now again, this is a laser that comes from the Cyton company. We only have the Cyton laser in our practice. And one of their particular modalities is the halo. And the beauty of the halo is that it is a no downtime procedure. It targets the brown spots and the red spots that we just mentioned that the BBL does as well. But in addition, it uses a fractionated laser of erbium YAG, which is the wavelength, that causes the skin, we poke little holes in the skin from the laser, and as a result, we get a reduction in the dullness of the skin and a contraction of the surface of the skin. So the combination of the use of an ablative laser with a profractional component, which is causing those little holes, and the non-ablative laser that's targeting reds and browns, we're able to address both dullness and we're able to address pigmentation in the same setting at the same time. And when you do this 2 or 3 times, you actually end up getting an incredibly nice result, because you're able to eventually cover the majority of the surface of the skin. One of the downsides of a fractionated laser is that you're only treating a portion of the skin, but that's why you need to do it 2 to 3 times in a row, so that eventually the entire surface of the skin, or majority of the surface of the skin, will see the treatment laser. So in summary, we have 5 treatments that we use regularly in our non-surgical practice. It is Botox. Botox we recommend 3 to 4 times a year, because it only lasts for 3 to 4 months, so you want to keep the muscles dampened as much as possible. Number 2, BBLs for browns and red spots, very common, especially where people get a lot of sun damage, especially in our generation where people were sunbathing it when they were young, and now all of a sudden their skin is showing all sorts of brown and red discolorations. We use fillers, but again, fillers in very small amounts in a very generalized way. So we're using it in multiple different areas, but a little bit goes into all these different regions. So you create a balanced overall volume augmentation, but you're not making the mistake of trying to lift the face with it. You're just trying to replace some volume, which can have very beautiful and meaningful effects in that setting. And then we're going to use microneedling to build up collagen, and that's going to be a relatively inexpensive, easy tool to recover from. We use that every, it can be as little as every 6 weeks to 3 to 4 months, in somewhere in that range, to keep that collagen production going. And then finally, if you've got a combination of conditions going on, the Cyton Halo is a fantastic laser for browns and reds, as well as dullness of the skin, and it can be used very effectively for the face, neck, and chest. And by the way, anytime you have any type of skin treatment, always treat the neck at the same time. That's a commonly forgotten area that oftentimes will be neglected, and as a result, as one ages, you start to see the neck showing significantly more aging in the quality of the skin than the quality of the facial skin, and you don't want to make that happen. All right, guys, I hope that helped give you a little bit of insight into 5 non-surgical treatments that really do have a beautiful place in anti-aging and facial rejuvenation. You can check in with your local med spas and dermatology and plastic surgery offices to see which one of these lasers and treatments and Botox will be appropriate for you. If you enjoyed this video, make sure you like it. If you have any questions at all, or you just want to comment, drop them in the comments below. I will do my best to answer as many of them as possible. And if you haven't already, hit subscribe so you can follow along and see more videos like this. We post 2 to 3 videos every single week on topics related to facial rejuvenation and education. And send this along to some friends and family. Let's get the word out. Let's help people learn more and be knowledgeable and empowered to make good decisions for themselves. All right, folks, I hope this helped. I hope this was good information. Thanks so much. Until next time.